Pneumonia. It's an respiratory disease. Look at this picture, shows that lungs, alveoli filled with fluid. Chest X-ray shows that pneumonia. And CT findings. Detail going on. Introduction. Pneumonia is an infection that inflames the air sacs in one or both lungs. It can range from mild to life-threatening, particularly for infants. Children, the elderly, and the individual with weakened immune systems. Pneumonia can be caused by variety of organisms, including bacteria, virus, and fungi. Definition: pneumonia is an acute infection of lung parenchyma, characterized by symptoms such as cough, fever, chest pain, and difficulty breathing. The air sac may filled with fluid or pus, causing productive cough with phlegm. Types: 1. Community acquired pneumonia CAP, acquired outside of healthcare setting. 2. Hospital acquired pneumonia HAP, acquired 48 hours or more after hospital admission. 3. Ventilator associated pneumonia, developed 48 hours or more after intubation. 4. Aspiration pneumonia caused by inhaling food, drink, vomit or saliva into the lungs. 5. Atypical pneumonia caused by less common bacteria like Mycoplasma, Chlamydophila, and Legionella. Causes: pneumonia can be caused by various pathogens, including 1. Bacteria, Streptococcus pneumonia, Haemophilus influenza, Mycoplasma pneumonia. 2. Virus, influenza virus, respiratory syncytial virus, and coronavirus. 3. Fungi, hospital osmosis, Idiomycosis, Cryptococcus. For other causes: chemical or physical injury to the lungs. Risk factors: 1. Age, young children and elderly. 2. Chronic disease, asthma, COPD, heart disease. 3. Weakened immune system, HIV/AIDS, cancer treatment. For smoking: 5. Hospitalization. 6. Use of ventilators. 7. Recent cold or flu. 8. Difficulties swallowing due to neurological conditions. Complications. 1. Bacteremia. Infection enters the bloodstream. 2. Lung abscess, pus filled cavity in the lung. 3. Pleural effusion, fluid accumulated around the lungs. 4. Respiratory failure, severe breathing difficulties. 5. Acute respiratory distress syndrome, ARDS. 6. Death, especially in high risk groups. Pathophysiology. Pneumonia begins when pathogens bypass the body's immunodefenses and reach the alveoli. This leads to an inflammatory response, attracting immunocells to the lungs, causing the alveoli to fill with fluid and pus, resulting in impaired gas exchange. Signs and symptoms. 1. Cough, productive or dry. 2. Fever and chills. 3. Shortness of breath. 4. Chest pain. 5. Fatigue. 6. Nausea and vomiting. 7. Confusion, especially in older adults. 8. Muscle pain. Diagnosis. 1. Medical history and physical examination, listening for abnormal lung sounds. 2. Chest X-ray, identify the location and extent of infection. 3. Blood test, determine the presence of infection and causative organisms. 4. Sputum culture, identifies the causative bacteria. 5. Pulse oximeter, measures oxygen level in the blood. 6. CT scan, provide detailed images if X-ray results are inconclusive. 7. Bronchoscopy, examine the airways if pneumonia is severe or not responding to treatment. Nursing diagnosis. 1. Ineffective airway clearance. 2. Impaired gas exchange. 3. Risk for infection. 4. Acute pain. 5. Activity intolerance. 6. Ineffective breathing pattern. 7. Anxiety. Disease management and treatment. 1. Antibiotics for bacterial pneumonia. 2. Antivirals for viral pneumonia. 3. Antifungals for fungal pneumonia. 4. Oxygen therapy to maintain adequate oxygen levels. 5. Fluids to prevent dehydration. 6. Pain relievers and fever reducers to manage symptoms. 7. Hospitalization in severe cases requiring intensive care. 8. Rest encouraged for recovery. Psychosocial medicine. 1. Educate patients and families about the disease and its management. 2. Provide emotional support and counseling. 3. Address anxiety and depression related to illness. 4. Support groups for patients with chronic conditions. Prevention. 1. Vaccination, pneumococcal and influenza vaccines. 2. Hand hygiene, frequent washing and use of hand sanitizers. 3. Smoking cessation, reduce risk of lung infections. 4. Healthy lifestyle, balanced diet, regular exercise, adequate rest. 5. Avoid close contact with sick individuals. In conclusion, pneumonia is a significant health concern due to its potential severity, especially in vulnerable population. Early diagnosis and appropriate treatment are crucial for a favorable outcome. Preventive measures such as vaccination and healthy living play a key role in reducing the incidence of pneumonia. Healthcare providers must remain vigilant and provide comprehensive care to manage both the physical and psychosocial aspects of this disease. Thank you. Have a good day.